Welcome to I Am the Change, addressing COVID-19 here and now, National COVID-19 Public Health Education Campaign as a part of the Health and Human Services We Can Do It campaign. We are focusing on Black History Month, Black health and wellness. But before we get into this discussion with our phenomenal panel, let me tell you a little bit about who the Black Women's Agenda is. The Black Women's Agenda, Inc., or BWA, has worked for over 43 years to secure, protect, and advance the rights of women of African descent. And we have worked to empower women worldwide to fight for a more equitable reality for African American women. BWA's mission is to achieve this vision by facilitating discussions such as this that lead to effective policies and meaningful change. We do much of our work through the facilitation of collaborative relationships with and among many national Black women's organizations. We have a network of 24 national collaborating African American women's organizations that reaches over 3 million women of African descent and their families. And so we're excited to be able to be here with this group of women who are members of many of the organizations of which are a part of Black Women's Agenda. So let me tell you a little bit about our dynamic panel tonight. First, we have Dr. Virginia A. Kane, who is one of the leading infectious disease physicians in the United States. She is the Director and Chief Medical Officer of the Marion County Public Health Department, which serves metropolitan Indianapolis, Indiana, and she's an Associate Professor of Medicine at Indiana University School of Medicine, Infectious Diseases Division. Dr. Kane serves as the chair of the National Medical Association Infectious Disease Section. She's a member of the National Medical Association Task Force and the Links Incorporated National COVID-19 Task Force. And she's a former member of the National Biodefense Science Board, which provides guidance to the Secretary of the United States Department of Health and Human Services and the Assistant Secretary of Preparedness. Next, we have Sylvia Cyrus, who is the Executive Director of the Association for the Study of African American Life and History, ASALH, whose mission is to promote research and preserve, interpret, and disseminate information about Black life, history, and culture, guided by the vision of its founder, Carter G. Woodson, the father of Black history. Ms. Cyrus is honored to lead a 105-year preservation of Black history and culture. She has formed and expanded lasting strategic partnerships with community leaders and emerging and corporate organizations, including the National Park Service. During Ms. Cyrus's leadership, the association received the Congressional Black Caucus Foundation Distinguished Organization of Voice Heritage Award and the Historical Society of Washington, D.C. Historic Achievement Award. Moreover, Ms. Cyrus is the recipient of the National Parks Conservation Centennial Award and named one of Washington, D.C.'s 50 influencers from the Washington Informer Charities Incorporated. And we have Rosalind Young Daniels, who is an award-winning president and founder of Black Health Matters, the leading health promotion and disease management online platform serving the needs of consumers, patients, and physicians. She is a tireless advocate for eliminating health disparities by improving the health literacy of African American consumers and patients. A former senior executive in broadcasting and publishing, Ms. Young Daniels is a nationally respected and award-winning health strategist with more than 20 years designing and implementing cross-cultural health education programs and initiatives. In 2018, Ms. Young Daniels launched the Black Health Matters Summits, which are a multi-platform initiative that features live TED Talk-inspired presentations by leading clinicians and health advocates. She is a graduate of Boston University and earned a certificate from the Tufts Diversity Business Program. And as I said, she is the recipient of many awards. And you can read more about these dynamic women on our website. But now we're going to get started with our discussion. So we are in a pandemic, and we've been here for a while. And one of the things that we know is that there are ways that we can mitigate COVID-19 in our communities. Let me start with Dr. Kane. Dr. Kane,
yes.
Let's talk a bit about vaccine hesitancy and safety. We know that vaccine receptivity and acceptance are influenced by many factors, but none stronger than the influence of our families, our family, friends, and trusted voices. Can you share your personal story of why you decided to get the COVID-19 vaccine?
So honestly, I got vaccinated because I love my family. I also love this country, and I also look to see the number of people of color that were hospitalized, that were dying at 3 times the rate of our white counterparts in people's life just before them. And I wanted to find a way, how could we stop the spread of COVID, the pain and the tragedy that occurred with this coronavirus pandemic? And I felt that no way could I be recommending people get vaccinated without stepping up to the plate and showing how important it is to be vaccinated. And of course, I got vaccinated. And I just want to encourage anyone who's patriotic to consider getting vaccinated. But I also know that for people of color, I think we have to step up to the plate to help ourselves sometimes. Mm-hmm. And that may mean, I know this is a personal choice, but I think it's important that you look at the science, read the science, find out the information for yourself, okay? And look at trusted voices and the evidence, and hopefully you're making some choices that will help to protect our communities.
You know, you mentioned trusted voice, and we certainly feel that you and all on this panel are a trusted voice. We hear over and over people sharing the concerns about the safety of the vaccines because they felt that these vaccines were developed so rapidly. When we talk about the vaccine, in order to build trust and ensure that our communities are willing to take the vaccine and to really assure that they understand about the safety and the effectiveness, can you talk a little bit about the science behind the development of the vaccines, as well as the whole process to get us to the authorization of our vaccines?
Yes. So let me just say, this has been one of the most rigorous, exhaustive process in looking at making sure the vaccines are safe. And we just didn't start developing and working on these particular new messenger RNA vaccines just this past 2 to 3 years. We've been working with these vaccines for 8 to 10 years, but we've just specifically used it for this particular virus. And we got a little bit smarter too. In terms of, we got so many medications out there that are new and they have to go to the FDA. And in the past, historically, they go by first serve is the first one that they look and evaluate these vaccines. And with so many out there, it might take up to 2 years for an application to get to FDA. But with the hundreds of thousands of people dying in the hospitals, folks couldn't get in with a heart attack. People just lying on the gurney. People outdoors because I've had a stroke and I can't get in because so many of these COVID cases, we had to move that application to the front of the line. So that saved about 1 year to 2 years just there. But the necessary steps that we have to do and process as we review all the data, we have to have a certain amount of data. So many clinical trials and patients have to be in all these studies. We have to look at those side effects. And so we have a huge panel of experts across the country that looks at the science. But the second most important step that we did was, normally we wait until it's FDA approved and CDC approved before we even start the production of the vaccine. And that takes about 6 months. And we said, well, we don't have that luxury. So if the pharmaceuticals think from their research process they did within their own shop that this is a good vaccine. Let's go on and start the production of these vaccines. And we'll either lose or win, but if they say it's okay, we've cut out 6 months of waiting for the production of vaccine. So we didn't do any shortcuts. And let me say now, we have had over 215 people been vaccinated. And you just talk about over 5 million people being vaccinated in the world. So we should have identified any of the major side effects by now with that many people being vaccinated. But look at how many people we have saved. Over 90% of the people in the hospitals are unvaccinated. Nearly 50% of the cases in these hospitals are African-American and Black, and they're dying at a higher rate.
Are you saying these are unvaccinated? 50% of these?
Over 90% of the people in hospitals, their hospitals with COVID-19 are unvaccinated, okay? And so when you look at those cases in the hospitals, we're in the hospitals at 3 times the rate.
Wow.
Compared to our white counterparts in the hospitalizations. So it's mostly us, people of color, that are being hospitalized here. And unfortunately, we're at twice the death rate compared to our white counterparts. So you're seeing us die. But remember now, because of some factors, sometimes because of poverty, you know, we have a lot of generational families because of social determinants have to all reside in one location where you don't have the luxury of social distancing. So we get a higher rate of spread of infection related to this.
You know, that's a really good segue to talk with Executive Director Cyrus, Executive Director of ASALH, because we know that, as we said, ASALH is the organization that preserves our Black history. And when we talk about people of African descent, we are literally talking about ASALH that is preserving our history. And I know that COVID-19 is going to go down as a major piece of our history. So Dr. Carter G. Woodson, who is the founder of the Association for the Study of African American Life and History, ASALH, and first established Negro History Week during the second week of second week of February, who first established Negro History Week during the second week of February. We now look to you every year to set the theme. Tell us a little bit more about ASALH, how Black History Month was founded, and about this theme for this year. And come off mute.
Thank you. And we really appreciate this opportunity to share information in a podcast like this. Is so important when we start talking about these trusted voices. These types of activities are exactly what Dr. Woodson had in mind when he founded the Association for the Study of Negro Life and History back in 1915, just a few short years before the first pandemic that really hit the stage in America that we are reflecting back on today. Dr. Woodson and his friends who started this organization were interested in making sure that the contributions and the stories of the life and history and culture of Black people were preserved, were researched, and disseminated throughout the world. And certainly we, 106 years later are still doing that. And as you mentioned, we set the Black history theme. Now you might think, and one might think, oh, we're talking about Black health and wellness. You know, this must have just happened a couple of years ago, right at the time of this terrible 2-year pandemic that has killed millions of people across this globe. But the truth of the matter is that Black health and wellness has been an issue for Black people since enslavement. That we chose this theme to talk about health disparities and the issues of health and wellness in our community. And it just so happened that here we are facing a pandemic, facing a situation where African Americans, unfortunately, do not know who to believe because there have been people who have lied to them, just as we have been lied to for years. And so we take this theme and the mission of this organization to say, listen to the medical professionals. We in our community have been intricately involved in the vaccine. We hear about Dr. Kizzy as we talk about her, but there were many African American men and women on this continent and outside of America who have been working on vaccines and medicine that have made it so more of us did not die. More of us were not infected with this horrible vaccine, horrible virus. And so this is what the association does. We are a 501c3 membership organization that celebrates Black history with the world in February, but we commemorate our history 365 days a year because of the tremendous contributions that we have made to every positive aspect of life here in this country, including our health and wellness, despite how poorly we have been treated at certain times relative to our health and wellness. We are having, in the month of February, a Black History Month Festival where we will be exploring these activities and things that we have done. And there are interesting and exciting stories that you want to hear about what has happened to Black people since enslavement. You know, we know how badly we were treated in slavery. However, the value of a Black woman was how many babies she could have and how she was rewarded for having twins or more than one baby. So our bodies, we were the queens of gynecology. All those experiments that happened on us were to make sure that Black women could deliver strong babies. And then what happened? So after enslavement, how did our bodies go from being so valued for what they could produce to now we're talking about Black women being welfare queens by, dropping babies all over the place. So we have medical professionals here. Dr. Kane can certainly speak to that better than I, but it is so important for our communities to know that we have a history related to health and wellness, that we have been experimented on, and many of the findings that have been out here in terms of the medical world have been born on our backs. And so come to our festival and hear more about it. There's some really interesting stories that you'll hear.
Hey, Kimberly, can I pipe in just 1 second here? Sorry.
Of course.
I think it's so important that we have got some dynamic healthcare professionals, scientists that have done remarkable achievements. Everybody knows the value of having a blood transfusion. If you're in an accident, you need surgery for something, you don't have enough blood. That was a Black male who helped to revolutionize blood transfusions in the United States, Dr. Charles Drew. Listen, Dr. Samuel Counts, I'm saying this because he was a pioneer for doing kidney transplants out of New York, but he went to a historical Black college in Arkansas A&M College. And then Ben Carson separated twins in her own. Kamisha Corbett, let me tell you, bad sister, that girl's so smart. When you become the leading scientist at NIH and you're African-American working on the Moderna vaccine, she's incredible. But what's incredible about all of these scientists, that they got out there, they did this work because they wanted to bring back to their own community. They wanted to help us. They've got mothers. They've got brothers and sisters and aunts. They've got colleagues and friends. And so we got to recognize what has been accomplished in this country related to Black healthcare professionals.
That's why I think this theme is so critical, because it not only talks about where we are now, but it allows us to go back and really look and see the breadth and depth of this contribution that Blacks have made. It reminds me of when I was growing up. I know I'm dating myself. Stevie Wonder had, in Songs in the Key of Life, the song Black Man. And we knew this song because they were calling off all of the accomplishments of people of African descent. And so it was almost like a rite of passage. If you knew all of these things, then you were really up on your Black history. But let me turn, speaking of Black history and how we get this information to our communities, let me turn to President Rosalind Young Daniels. You have a major platform in Black Health Matters. And you have resources, you have really crossed the gamut in terms of health. What we know, as Dr. Kane and Executive Director Cyrus has said, we've had these disparities, but COVID-19 has really pulled the cover off. And we know that, as we said, and we know the data is saying that, it's disproportionately impacting our communities of African descent. So tell us about the resources, tell us about the services, and tell us about how you get this information to our communities to help to really address this gap in our health issues.
So thank you for having me, and it's wonderful to be here with this esteemed panel this evening. I launched Black Health Matters in 2012. We've had many pandemics. And so this is just one of them. We launched in 2012 because of the Affordable Care Act. So understanding that African Americans and all Americans would have access to care was something that I was just very passionate about. But then I soon learned that access to care means nothing unless you have an understanding of health literacy, unless you understand some of the basics. You have to hydrate, you have to rest, you have to manage your stress. So we've been having issues in terms of a pandemic for many, many years, as our doctors have said and Sylvia shared. But so when COVID came, what we knew is that it's very difficult to believe what you hear. When COVID first broke, there were people who said, Black folks can't get COVID. Do you all remember that?
Yeah. Mm-hmm.
There's so much misinformation.
That is right.
This will not change. Smart heads must prevail, meaning that we need to be resourceful and examine the resources that we get our news and information from. So let's be conscientious. Obviously, we're very bullish about Black Health Matters because we offer more than 2,000 pages of content on the African American experience as it relates to health and wellness. But let's think about newspapers that are credible sources. Let's think about churches, right? They have come forward. They're forming coalitions because they want people to be healthier. So if you don't want to listen to one side, let's think about what the churches are doing. My church, Abyssinian Baptist in Harlem, they have a COVID truck out every Sunday. So you can get your screening and you can get your vaccination. So let's look at the services right there in our communities. Let's think about fraternities and sororities. They are a key institution living in our communities where we live, work, play, and worship. So they're credible sources. Professional organizations such as the Links Incorporated with their outreach and their committees. And then again, we do revere our African American doctors because they are on the cutting edge. So many doctors felt so convinced that they needed to take a stand that I've seen more advocacy groups within doctors' organizations, not just the National Medical Association, but Black Doctors Against COVID. That was formed. We have another doctor who started her practice and her advocacy because she started going out into the community and screening people in neighborhoods that were pharmacy deserts. So there are many resources within our community that we can avail ourselves with. We just need to be smart about it, resourceful, and use our common sense.
So we've heard a couple of words here tonight that has been that I want to make sure that everybody takes away. We need to follow the science. We need to really look at credible sources on how we take in the right information and use our common sense. And we need to understand our history, because when you know where you came from, you know where you're going. And so what that takes me to now is, what is the last word we want to give to our listening audience in this time, in this place, Black History Month, as we celebrate Black history and Black future, because that's really critical. And with under the theme of Black health and wellness, and I'm going to start with Executive Director Cyrus. What do you want to leave us with?
Well, I'm going to tie into what all the panelists have said. There are many credible organizations medically that are out here to help our community. Attach yourself to one of them. When it comes to our history, join ASALA and organizations like ours, where our history is being studied, because it's so important for our young people to know that although we are in the challenges of this moment, that we as a people have survived unsurmountable odds and have still come out on the other side and have brought America with us. So we will get through us. Don't get so bogged down in this that you think it's the end. It's not the end. It's a new beginning. Go to your history, join the community, study how powerful a people we are, and we will really rule the day.
Thank you. Ms. Rosalind Young Daniels. Give us a final word. Tell us about your upcoming Black Health Matters summits, and what do you want to leave us with?
Yes, so I'm going to say, claim your new normal. Things may not ever be the way that they were. So if you can't go to your local gym because you are concerned about the way that people are not wearing masks, or the hygiene isn't the way that you want, claim your new normal and develop a new exercise routine. Buy equipment, take more walks, claim your normal. People are not getting screened. They're not going into the doctor's office. So I know they're saying that there's an expectation that there are going to be more rates of advanced cancer diagnosed in 2023 and beyond. Continue with your screenings. Make sure you address your mental health. So many people are depressed. This is a new normal. We can't all do what we used to do. So claim it. Make your plan on how to live and thrive. On April 30th, we are going to have our next Black Health Matters Summit, which will be in Harlem, New York. It's going to be at the Riverside Church. It's an all-day event. We have more than 18 sessions planned with leading thought leaders from across the country. I'm so glad that we were able to have Kimberly at one of our past summits as she interviewed Dr. Fauci. So it's a chance, we call it kind of like the BET Awards of Health, right? It's well produced, it's entertaining, it's fun, you can network, and it's all virtual. So this year we will have a hybrid because we will be having screenings on site. But if you don't want to come out personally, just watch on and sign up and register, and everything is free to the public, and we look forward to having everyone attend.
We will make sure that we have that link on our site so that our listeners can participate. And I know that for the Black History Month Festival at ASALA, we'll have that link too, because that's going to be going on the whole month of February, right, Executive Director Cyrus?
That is correct. We'll be on YouTube, and there are plenty of videos that you can go back and look at all during the year, but especially this month, that you can use in programming for other events that you might want to have locally.
Okay, so we'll be there, and we'll be there in April. We'll have that information. Make sure we have the information for what is happening now and what is going to be ongoing throughout the month of February that is tied to ASALA and the Black History Month Festival. So Dr. Kane, what do you want to leave us with?
So, you know what, I just want to commend my colleagues here, Director Cyrus, and wow, Black Health Matters, Ms. Daniels, and of course you as our host, Kimberly. Just remember that the number one person that does decision-making for healthcare in a household is the woman. This is a Black History Month of strong women that are out there, and we can make a difference. And we'll continue to make a difference from generation to generation, from my grandmother to my mother to my children. This is a wonderful opportunity for us for growth, but also we're role models, and we need to mentor and bring somebody along with us. And I think as we continue to do this community education, community promotion, we're going to continue to make a difference in the lives of our people, because we faced challenges in the past forever, and we've always stepped up to the plate. And I'm just inspired by all of the different people that are just stepping up to the plate. People on the front lines, folks you least expected, stepping up to the plate. It's just been incredible. And I'm just honored to be in this era experiencing what's happening, because United States is never going to be the same again after this coronavirus pandemic. You have seen a turning point for the people of color.
You have. Well, you've heard it here. Our three phenomenal panelists. This is our agenda, the Black Women's Agenda, Inc. I am the change. We are addressing COVID-19 here and now. Our Black History Month focus is Black health and wellness. Go to our website. You'll see all the information about our phenomenal speakers. You'll see information about Black Health Matters, Black Health Summit. And of course, we'll be celebrating Black History Month all month long with the Sala, and that link will be there too. Thank you all so much for joining, and we'll see you on our next podcast.